Now to a very big change to the CDC guidelines. Health Secretary Robert F. Kennedy Jr. says that the agency is no longer recommending routine COVID shots for healthy children and pregnant women.
Kennedy, as we have been reporting, is a longtime vaccine skeptic. He made the announcement yesterday on social media.
And many medical professionals call the move concerning and confusing and warn the changes put certain populations at risk.
Immediately when we thought about doing this story, who we wanted to talk to, we thought Dr. Darien Sutton. Look who we got, Dr. Darien Sutton joining us. And I'm glad that you're here because I always love to hear what your thoughts are from a medical standpoint, that education that you had. Tell us what your reaction is to this new guideline.
Confusion. Often these types of decisions are done through panels of independent experts and organizations like the American Academy of Pediatrics. And yesterday, I reached out to the American Academy of Pediatrics, and the same confusion was shared. We often see decisions that can sometimes, especially with this administration, come very quickly. But when it comes to your health, it brings great concern, not just from me, but with our entire medical community.
And Kennedy also says there's a lack of clinical data to support repeat boosters in children, but pediatricians have argued that newborns, they are at a higher risk for hospitalization from COVID. So what does the science actually tell us about COVID vaccines for kids?
Recently, Kennedy had made a statement that said, make sure you listen to the medical professionals when you're getting your medical advice. I agree with that statement. And I want to say that when we're talking about kids' health, talking to pediatricians is really where you should start that discussion. We know through a tremendous amount of data, this vaccine has been given to over 13 billion people around the world. We know that through this time, post-vaccine provision monitoring, we understand these vaccines are safe, they are effective, and most importantly, they reduce the risk of hospitalization and death. And I'm speaking to this as a correspondent, but as a physician, I worked throughout the pandemic in both New York and Los Angeles, and I can speak to the fact that I've treated many patients who you would not suspect would be so sick from having something like COVID-19, but require hospitalization, and that is shown in the numbers. 4 out of 10 children who are hospitalized for COVID don't have an underlying health condition. It speaks to the fact that any of us can be vulnerable to this, so it's so important to protect against it.
So the new recommendations, as you mentioned, you said they're confusing to you because the CDC on their website, they say that pregnant women are at risk of COVID, at a higher risk, but now the recommendation is saying, hey, we're not recommending it towards you. So it's confusing. What do you take, especially the new recommendations for pregnant women specifically?
I think that's one of the most important points about this. During pregnancy, that's an incredibly high risk period, arguably one of the most dangerous, medically dangerous parts of a woman's life. I think we have to just acknowledge that. Getting COVID-19 during your pregnancy increases your risk of complications like preeclampsia, blood clots, the need for a C-section, hospitalization, ICU care, and death. And so it's so important for pregnant mothers, and especially because we've seen a low vaccine participation rate among this high-risk group, that they understand the benefits of vaccines and reducing the risk of hospitalization, reducing the risk of death. And also there's an added benefit. When you get your vaccine during your pregnancy, you can pass those passive antibodies on to your newborn infant, and we cannot vaccinate children up until after 6 months. And so those first 6 months are a very important time to protect against infectious diseases. And children under the age of 6 months have incredibly high risk of complications from COVID-19 comparable to those over the age of 65. We often talk about the elderly who suffer from this diagnosis, but many people do not realize the infants that we also need to treat.
I was in my 8th month of pregnancy when the COVID vaccine was finally released during the pandemic, and I can't believe that. I have a 3-year-old, 3.5-year-old. And it was scary doing it, but I knew what I was doing for my baby, and it was worth it for me. And it's just so interesting to see where we are right now. But your perspective, as always, is so very needed.
Well, I think it's so important to understand that there is no scenario where the infection is a greater or a lower risk than getting vaccinated. And so you have to remember that. You're always choosing the lowest risk option, and that includes getting vaccinated. There's 3 to 4 million children born every year. We have to protect them. They have not seen the pandemic. They don't have any immunity.
That's why it's so important to consult with your doctors.
Absolutely.
Have a conversation with your physicians you trust, and that's the important thing to do.
Absolutely.
ABC News medical correspondent Dr. Darien Sutton.